Hello, we on?
We are. We hear you. We'll get going here in just a minute.
I tried to get here before 1:15 because you guys scared me last time.
That was on me. Sorry about
No,
that.
that's okay.
I'm watching my phone time this time.
One of those things your dad always says, if you're not early, you're late.
Yeah, that was my grandma. She said that. I hear her in my ear always. Not everybody hears that in their ear, though.
Okay, I do have 1:15 straight up, so we'll go ahead and get going. Thanks everybody for being here again. I am Chuck Carney, Director of Media Relations for Indiana University, and welcome to our weekly update with the city, the county, and Indiana University Health and IU itself. Today on the call, we will have Mayor John Hamilton, Monroe County Commissioner Julie Thomas, IU Health South Central Region President Brian Shockney, Monroe County Health Department Administrator Penny Caudle, Monroe County Emergency Management Director Allison Moore, and IU's Assistant Vice President for Strategic Partnerships, Kirk White. So let's start off with Mayor Hamilton, get things going.
Thanks very much, Chuck, and that's a great lineup. So let me just try to jump right in. First, I want to share a little news with folks that we have decided to reopen City Hall to the public on Tuesday, May 26th, the day after Memorial Day. City employees have all been working, every one of them, through this emergency, but we did shut down public access to City Hall. That will reopen. It'll be in a new limited way, controlled, being careful, probably focused in the lobby on Tuesday 26th, just to let people know that. Then let me just quickly, thanks again. I want to express on behalf of the whole community to our healthcare system, from frontline nurses and doctors to scientists and researchers, of course, to the public health experts who help us manage and protect all of our health. I also want to thank the whole community, which has stood up and stepped up and stayed home and physically distanced and taken care of each other and avoided non-essential work and non-essential travel. And all of that has brought us some good news, really, for our community, that thus far locally, we continue to avoid a surge in our healthcare system as a result of COVID-19 and relatively slow and low caseloads of that disease in our county, relatively low hospitalizations and relatively low deaths. And so, as we know, we're going to be moving forward with some modifications, and that's all good. I do want to express some concerns that I feel on behalf of the community, and then pass that along. First, we all know many healthcare experts are warning us of moving too fast and risking a resurgence of infections. And we are at very low numbers of testing in our state, in Indiana overall, and in our county, even compared to our state. The first preliminary prevalence testing in late April that was done in late April, just was released, that showed about 2.8% of Hoosiers appear to have been infected with the disease. That tells us that there's about 10 people who are or have been infected compared to every one that we know about. For every one we know, there are another 10, it appears, that have been infected or are infected. And nearly half of us who've been infected or are infected have no symptoms. So the next testing's coming in June, and it's really good that we're doing prevalence testing. The data have suggested, as I indicated, that modifications are in order, and I thank the public health care system for doing that. I would urge two things in our community. First, that we continue the protective measures, especially the physical distancing and personal hygiene, and yes, masks in public, when you're out in public, to wear masks. And the second thing is, I really urge that we need to be patient in our modifications. We need to let the data continue to inform each step, so that and also that we give the data time to catch up to what's happening on the ground. For example, I'm concerned that it will take more than 2 weeks past May 31st for us to know whether this first round of modifications, which I support, have caused any surge or backsliding. What we Now, here's the bottom line too. What we do as a community will determine how we go forward, how we behave, how we do in terms of physical distancing and masking and protecting each other and our families will determine our future paths. So I'll close with a couple exhortations, and you're going to see a video about it too, I think. Please keep distancing, wear masks when you're out in public, and follow the personal hygiene, protecting yourself and any fellow workers or family members that you have. Just as a reminder, I was on a walk through a park, city park, not long ago. I saw 50 people, I counted as I did my walk, on the trails or very near the trails. 4 were wearing masks out of 50. I think we need to see more than that to keep being able to move forward, because we know the disease is with us. It's 10 times more than we measure. So, and the second thing is just to encourage people to be patient. As we move forward, as we have been patient, let's know that we want to move forward safely and steadily. And I guess better safe than sorry is kind of the measure I want to say. So we're looking forward to some modifications coming. And I really appreciate the public healthcare system that's done so well in our community. And I'll encourage us to keep moving forward safely and steadily. Thanks very much.
All right. Thanks. We'll next go to Julie Thomas.
Hi, thank you, Chuck, and thank you everyone for being here. Just a quick note of thanks to first responders, all of our healthcare workers, county health department, emergency management. Everybody's done such a great job and really helped protect us and kept us safe. So that baton's handed off to the rest of the community as we're asking you to please care for one another and practice those items that are in the pledge. Sign the pledge, join us on social media and sign that pledge. For Monroe County government, we're moving on to our next phase in the continuity of government plan for infectious diseases. Public buildings will remain closed, but more employees will be coming back to on-site work beginning on Monday. And again, like everything, we're going to be led by science and data, and we're going to keep an eye on things to make sure that this is being done safely. And if there's any issues, we will go back to a more restrictive environment. But just because our public buildings are closed, county government is still operating just as we have been from the beginning. Work continues to be conducted online and by phone. If you need something, please go to our website or call the department. On May 13th, the county commissioners did extend our emergency order. This relates not to the community at large, but it does relate to the functioning of our county buildings and county operations, and to ensure that our employees continue to be paid. Lastly, we have gone ahead and granted additional funds. This is the food and beverage funding. So we appreciate the work of the Tax Advisory Commission and the County Council in assisting us. We are talking to small businesses outside the city of Bloomington, but within Monroe County that have some tourism related aspect to their work that have been impacted by COVID-19 pandemic. So as of Wednesday, we have granted money to 24 businesses in the county for a little over $192,000 total. And we're really proud of that. So thanks everyone for your flexibility. Thank you for being patient, and thank you for putting members of the community first as you practice social distancing, washing your hands, staying home when you're sick, and wearing that face covering. Thanks so much.
Okay, next let's go to Brian Shockney.
Yes, thank you. I also want to give my thanks to everyone, most importantly to our community for doing what they're doing, being patient with the restrictions. And now we're seeing, obviously, the data that's showing us improvement, and the health department seeing the ability to relax some things here in this next phase. And so we're very appreciative of the health department and their leadership and their careful consideration of keeping and protecting our community. Second of all, I'm known for celebrating every day, national days, and as we're in this last day before the health department relaxes some restaurants, today is National Pizza Day, and so we celebrated by eating pizza from one of our favorite restaurants here in Bloomington for lunch. And I would encourage you to today on National Pizza Day to focus on our businesses who serve pizza. It's also National Chocolate Cookie Day. Chocolate chip cookie day, and there we also got some great cookies from a local business establishment for lunch today. And again, the last day before restaurants can start opening for expanding. So I would encourage all of you for your lunch, dinner, whatever today to frequent our businesses for pizza and chocolate chip cookies today. That would give them a good boost. So I have three things: new goals, emergency care, and antibody testing. First one is some new goals. We're adapting our goals as we move toward providing more surgeries, opening all of our clinics, moving slowly back toward providing care. We have what we call recovery teams. And so we've got SWAT teams and recovery teams in all of our local and regional areas that are going in and making sure every situation, every building, every employee, team member is prepared for patients to come back. We've started that this past week, and it's going very well to be sure everyone's masked, everyone's protected. And I would say on behalf of all the healthcare providers, you're very safe with Monroe Hospital, with Bloomington, IU Health Bloomington, with all of the providers, dentists. They know what to do. That's their expertise. And so as you get called to go back to your care, we're finding that people have put off care for some time. And our acuity level in our emergency departments and in our clinics is much higher than it's ever been, because people have been fearful of seeking that care, and rightly so. And so we just want you to know that we're all the businesses, all the healthcare providers are open. They have got the great PPE, all the PPE and great practices to protect you in every way. And so we just ask that now you start following those health and wellness. Let's be sure our community stays health and well as we go forward. And then I also want you to know about antibody testing. The CDC currently has not given any guidance on antibody testing, or serology as we call it in healthcare. There's a lot of interest in this. And while there's been some promising studies, we ourselves, IU Health, has been doing some studies as well. There's still no scientific consensus on the effectiveness of any kind of antibody testing. And so we're hearing stories of people who are buying those tests from overseas, and they're 20% effective at best. And then you get a false sense of security, and then the virus ends up spreading. So we don't know what it means to have immunity at this point, because this virus is so new. And so we just ask that you have patience, know that we as the world, as well as the healthcare nation, know how to do these things, but it's going to take some time for us to develop this testing and be able to have specificity in this testing as well. So I wanted to make sure that there were some questions about that. I want to be sure you understood. We, IU Health, and many others are working on this, but really at this point, there's not enough evidence that any one test is providing what we need. And I'll just close with thank you for all of you in advance for taking the pledge to keep others and yourself safe and well. And as we are going to see a video hopefully here in a few minutes, we would want every one of you to take that pledge. As the mayor said, I also saw some evidence of not wearing masks. And then the other night on my way home, I was driving through Bloomington and saw several people with masks, which was made me very happy. So let's just make sure every time we're driving through Bloomington, we're seeing people with masks. Thank you.
All right, thanks, Brian. Let's go to Penny Caudle. Now we hear you.
Okay. Dr. Sharp just wanted to make a statement first.
Okay.
To follow up on what everybody else is saying, I hope the community gets this message loud and clear, because it's a big deal to us and to them too. We are continually looking at data and are carefully moving forward. and we all want to move forward. We are considering information on physical needs of people as well as mental health needs, as this pandemic is taking a toll on both. As we move forward, it will take the whole community to do their part and make this work. And as part of this, we are encouraging all residents to sign and commit to the following 5 steps, which have been alluded to try to contain this pandemic. And this statement is on the health department website. And it's 1, I will maintain the 6 feet of social distance. 2, I will wash my hands often. 3, I will wear a face mask when covering in public if I can't social distance. That particularly goes for in stores. I will wear a face mask when I'm sick. I will get tested immediately if I have symptoms. We're all in this together. We're only going to be successful in moving forward, which we all want to do, if everybody takes part. Please sign the pledge again on the health department website.
Thank you, Dr. Sharp. I just wanted to talk a little bit about the health officer order that was released earlier this week and talk about the changes. So essentially, Monroe County will be joining the Indiana state plan in stage 2 with some adaptations. And if you're wondering the differences, I'm going to go through those. But if you're also wanting some specifics, the guidelines are in the governor's order, and that can be found on the governor's website. So those guidelines will be in place, except where we are more restrictive. So some things to keep in mind: every business needs to have a prevention plan prior to reopening. So even though some businesses may be able to open tomorrow or could, it doesn't necessarily mean that they're all ready. And that's part of what we've heard from businesses, and we believe that we'll have kind of a staged opening of businesses because of that. But they do all have to have a prevention plan, and that has to be posted. Gathering size in this phase will be limited to 25 people or less. That doesn't mean that we have to have groups of 25. It just means that that's the maximum number. And we are still safer at home and in small groups. So while we may be easing some of these restrictions, we do want to remember that we are still safest at home, especially if we fall into a high-risk group. Then we would ask that you continue to stay home and follow the previous guidelines. We need you've heard this from everybody else too. We need to maintain that 6-foot distancing. We need to wear face covering in public when we can't maintain that distance. And I'm going to give a couple of examples myself, and for better or worse, I live in a walkable neighborhood. And so it's nice to get out and get fresh air and take that walk. So when I walk, I'm generally walking alone. So do I wear my face mask? No, I'm walking alone, but I take my face covering with me so that if I need it and I need that buffer, I can't maintain that 6-foot distance, or I run into a group of people and we stop for a conversation, then I have my face covering and I can put it on. If I'm going to the grocery store, I travel to the grocery store, and in my car, I'm going to put hand sanitizer on. When I get to the grocery, I'm going to put my face covering on. I'm going to very quickly go do my shopping, come back, take my face covering off, cleanse my hands again, and then go home and take care of putting my groceries away. So we have to be mindful about all of the things that we're doing and the situations where they're warranted. So pay close attention to those things. Those are 2 of the most important things that we can do. As we moved forward in this and had to make these decisions, we've talked about this before, there's lots of information that goes into these decisions, and none of them are made lightly. There's lots of pieces of information, and we've talked about the gating criteria that we use as kind of a guide, and that information is on the CDC and the state's website. The state's dashboard has the ventilator and the hospital bed usage. There's flu view and COVID view that people can see kind of what those illnesses are looking like. So all of that information is out there. You've heard us talk about contact tracing and enhanced contact tracing, and that started this week. increase testing in our community and in the state so that more people can get tested. I will talk a little bit in a minute about the glitch that we've ran into locally, but it is still coming. But even so, there's additional testing sites throughout the state. And if somebody needs a test quickly, and they can't get an appointment here locally, there are drive-through clinics, there are Optum clinics already going in other communities, and people are welcome to visit those. And on the state website, there is a testing page, shows you what testing sites are available, when they're open, what their requirements are, and you can utilize those. You have to be an Indiana resident for the state sites, but you don't have to be a county resident for wherever that's occurring. Getting back to the data just a little bit, I think about it like a puzzle. I've been trying to think about how can I describe how we look at this from a public health perspective. And the only analogy I can really come up with, and I hope that this makes sense to others, is that it's like putting together a puzzle. There's lots of pieces of information, and you have to have all of them come together to kind of form that full picture. But it's really not until the end that you see everything. And you're going to have some pieces that fit easily, some that don't. I think about that hard data, those numbers that people often want to see. What's that magic number, which there is none. Those are those outside pieces of that puzzle. And they kind of put the frame around it. But then there's all this other information. And it's what the hospital is reporting locally, and even just what the staff are feeling, what our public health staff are feeling, what businesses are telling us. All that kind of information goes into those decisions. And there are times when we're going to think that a piece fits well somewhere, and we're going to find out it's not the right spot for it. We need to kind of pull back and regroup and reorganize. And that's what all of this is. With a pandemic, we have not been here before. None of us have been here before. We're learning as we go. We're going to make mistakes, but we have to look at and make the best decision we can at the time with the information that we have. So that's what we're really trying to do. So lots of information, and it really is very much putting the pieces of a puzzle together. To talk a little bit more about the Optum testing site, we did expect that site to be up and running by now. However, we ran into some challenges with the original site location, and we had to kind of go back and review optional sites that we had. It will be probably late next week before the site is up, because we have some changes that have to be made to the new site location. If someone made an appointment, the state did have the site up. Optum was scheduling appointments. So if you made an appointment and it has not been rescheduled, just know that the site is not open. You should get a call from Optum to reschedule your appointment. And as soon as we know exactly when the site will be up and operational, we will post that on our Facebook page and on our website. And we'll send that out to the media and our other community partners here so they can help us spread that information. So while you could make an appointment early, we will let you know when we are certain that we have an opening date and everything is in place. And I apologize for anybody who had appointments rescheduled or they didn't get rescheduled. We don't have access to those appointments, so that wasn't anything that we could fix for you. I mentioned earlier that the state does have the website for testing. And so there are other opportunities to get testing in the meantime if you need to do that quicker. In terms of talking about face coverings and masks, I know that some people are wanting a mandate for everybody must wear a face covering if out in public. And again, remember that we have to be able to maintain that 6-foot distance, and those face coverings are when we really can't do that. But there are also issues with some people who have medical circumstances that may prevent them from wearing them. We may not know about that. There are enforcement issues as well, and capacity around enforcement. Certainly in this next phase, there are requirements built in around face coverings that were not in the phase that we're in right now. Tomorrow, there will be some new restrictions around face coverings, and all businesses are asked to consider and should wear face coverings and should ask their patrons to wear them as well. So it is an expectation that people will wear a face covering when they're in public and they can't maintain that social distancing. And shopping or going into stores is that perfect example. So we do need everybody to take part in that. And you've heard us talk about the pledge and asking everybody to do that. So we as a group have taken a pledge, and there are 5 commitments to this. And the pledge kind of reduces them. It's very easy, but I will maintain a 6-foot social distance. And again, that's so that we protect one another. I will wash my hands often for at least 20 seconds. Good hand washing requires soap and water, 20 seconds. And we need to do that frequently. And if we don't have soap and water available, then hand sanitizer is the next best thing. I will wear a face covering when in public. And again, if you're in public and you're alone, it's great. It's not a requirement, but if you're around other people and you can't maintain that 6-foot distance, you definitely should be wearing a face covering. And I will stay home when I am sick, and I will get tested if I am sick. So that's the commitment that we are taking, and we are asking everybody else to sign that pledge. We will post that pledge so that you can print it and you can sign it too. We are asking everybody to take that pledge with us.
Okay, did you want to show that video?
That would be wonderful, Chuck.
Okay, and while I'm getting that set up, there's a question that's come in about whether the tests are free. And if you can answer that while I'm getting this ready.
Sure. At OptumServe, the tests are free. If you have health insurance, they will bill your insurance, but there is no copay involved. And if you don't have health insurance, there is no charge. So you don't have to worry about that. You do have to be an Indiana resident. And so actually signing up is relatively easy. There are a few steps to that. So you'll have to go in, you'll have to set up an account because that's how you'll get your test results as well. But it is free.
Okay, I think that I am sharing the screen and we will see if this works. Though I need to make sure that I'm sharing audio as well.
I'm glad you're in charge of that and not me.
Okay, here we go. Got to be fascinating for people to watch.
Because I care about our community.
And clearly I need better Wi-Fi.
I signed a pledge to wear a face covering in public places. Won't you sign the pledge too?
I pledge to protect you, to protect me, and protect our loved ones and community.
Frequently, wearing a face covering when in public and can't keep that 6-foot distance, staying home when I'm sick, and getting tested.
I'm taking the pledge. During this pandemic, I will maintain 6 feet of social distance. I will wash my hands often for at least 20 seconds. I'll wear a face covering when I'm in public. I'll stay home when I'm sick, and I will get tested immediately if I have symptoms.
I just signed my pledge. It's all right here. I'm going to try to do my part to keep people healthy.
I'll wear a face covering or a mask when I'm in public. I'll also stay home when I'm sick, and I'll get tested immediately if I have symptoms.
I plan to pledge to join with the health department. I will maintain 6 feet of social distancing when I can. I will wash my hands often for at least 20 seconds.
And I'm going to take the pledge today to do the 5 things: to maintain social distance, to wash my hands, to wear a mask when I'm in public, to stay home if I'm sick and if I feel symptoms to get tested. And I hope you will take that pledge too.
I challenge you to join me.
I took the pledge. Please join us.
I've taken the pledge. Will you too?
Each of us, what we do will determine how we move to the future the way we want to, safely and as efficiently as we can. Take the pledge. Thanks for helping Bloomington out.
I'm taking the pledge. How about you?
Okay.
Thank you for putting that together, and thanks IU for putting the video together, and we hope that everybody will join us and take the pledge.
All right. With that, we'll go to Allison Moore.
How do I possibly follow that? It's wonderful. Thank you so much for putting that together. And thank you, Brian, also for letting us know that it was pizza and chocolate now the menu for dinner for family for sure. We do have a first responder rate this evening. It will be in the Monroe Hospital area. So if you live in that area, you will see some lights and hear some sirens. We're excited that our first responders are coming together to support our healthcare providers at Monroe. We continue to support our health department. And
Allison, you're breaking up quite a bit here. You might try audio only, see if that's a little bit better.
okay. Is this, oh. How about that?
Okay, let's go ahead and we'll see how it works.
We continue to support our health department and our first responders. And one of the things that we're doing is making sure that if those individual agencies wish to get and we want to make sure that if anybody is planning to get FEMA reimbursement, they get that application in. Any of those agencies, of course.
Allison, I think it's breaking up too much. If you would do this, can you type your updates in the chat real quick? So some of the significant points, it's just we're not hearing enough to understand everything that you're saying.
I will do so. Go ahead and proceed, and then I'll type a message.
Okay. All right. Thanks very much, Allison.
Thank you.
Kirk, we will move on to you.
All right. Thanks, Chuck, and good afternoon. From IU, I need to report that the majority of our employees continue to do virtual work, teaching and learning remotely. The summer sessions began on Tuesday, the 12th of May. Of course, those are all online. The only employees we have back on the Bloomington campus are those that are doing essential services and a few of our research activities that need to continue and be monitored. The university, particularly the Bloomington campus, Provost Rebel has appointed 10 different restart committees, which include 150 of our students, faculty, and staff leaders. And these different restart committees are looking at all aspects of how we get the campus back up and running in a safe and efficient manner again, in a phased way of following both the governor's and the local guidelines that are being published. So that work is continuing as we speak, and we expect a larger university-wide restart policy from our university-wide committee that covers all 7 of our campuses, that to be released shortly, which will give us additional guidance as well. The campus restart committees are covering areas such as academic policy, how we'll conduct classes, utilize space in our classrooms and offices and other places, student life, personnel policies, research policies, finance, auxiliary, and support services. So it's we're like a city within a city, and I'm glad we have all of those leaders working on these policies. And a couple of final things. I think it's important to note that even though we have students working online, for all over the world, but many that are still here in the area. Our Indiana University Health Center is still in operation for acute care only. The pharmacy remains open as well. And importantly, they're also available for online counseling and psychological services as well for those who might need that type of support. And then finally, as most of you know, we normally have a very robust new student orientation in Bloomington. This summer, that will all occur online and not be conducted in person starting in mid-June. But this continues our preparations to get back to some level of teaching at the Bloomington campus in August. And that concludes our report for today.
All right, thank you very much, Kirk. And Allison has submitted her primary points on the chat. And for those watching on Facebook, I'll recap that. She says, Monroe County Emergency Management is taking homemade masks to our locations, distribute to our community. Drop-off sites are on the website. The deadline for FEMA reimbursement is May 31st. This is for not-for-profit or government agencies. And again, see the website for information. So on to some questions here. I'm sorry, one more point from Allison. County blood drive is June 23rd. Please hold that date. As details become available, more information will be on the county website. Okay, now to questions. First from Dave Askins from the B Square Beacon. A quick poll type question for all the public servants on the call from Dave Askins. Without prying too much into your personal lives, do any of you have any specific plans on Saturday or Sunday to visit a restaurant for dine-in service? Why or why not? And Dave asks or adds parenthetically, Brian, it's not fair to cite the fact that Pizza Day will be over as a reason not to.
Well, I'm a foodie, so I'll go first. You know, it's going to be Cracker Barrel or Bob Evans, whichever first gets opened and I can get into.
That's good.
Anybody else with plans to visit a restaurant on Saturday or Sunday?
This is Penny. We've been supporting our local retail food through takeout, and we'll probably continue to do that over the weekend. I can tell you that I'm certainly looking forward to the time that I'm in a retail food establishment eating, but when I get an opportunity to just be at home, right now I want to take advantage of that opportunity, and work isn't stopping. So I will probably stay at home and work over the weekend and get some takeout.
Oh, Mayor Hamilton, I think you're trying to speak, but still muted.
I can report, while I certainly welcome the chance for restaurants to move forward safely, I don't expect I'll be doing dine-in. I can also report, I actually asked my cabinet this question yesterday. We had a 20-person Zoom call, and actually only one or two said they thought they would go out to eat. I think safer at home and doing this incrementally is the way a lot of people are going to approach it. So, but good luck to all, and let's all be careful.
Yeah,
I'm a lot like Penny. I've been working a lot of hours, and I plan to try some more carry out as well to keep those restaurants going.
Yeah, I supported National Pizza Day early by going to Cafe Pizzeria for takeout, and that's my favorite local one. So that's generally what I would stick to. Let's see, other questions. Brian Shockney, this is from Emily Ernsberger from the HT. Last week you said that one of the reasons for extending phase 1 in Monroe County was because if a surge had occurred, IU Health Bloomington would not be able to handle it. Do you currently feel more comfortable, and was that one of the data points used for the county to move to phase 2? Brian, still muted.
If you could put that slide up, Chuck, that I sent you in advance, I think that'll help answer that question. So as he's putting the slide up, when the governor relaxed and went to a little bit and went to phase 2, that's when I think I shared the data here. We were in a position where, as you can see here, the governor's order went in. We were in a little surge, and we had been pretty steady for some time. When we continue to provide the data to the county health department, you can see this continuous decline. And we believe we've hit, and these are Monroe Hospital as well as IU Health data, we believe that this may be our new normal. And so, yes, we are comfortable at this point. We weren't before because we were still operating both of our ICUs with COVID patients. We still were seeing a high number of patients in both emergency rooms that were tested because they had symptoms. And that has also declined as well. So as Penny said, I love her analogy as a puzzle. It's not just the numbers, it's the numbers that we're testing because we suspect that they may have it as well. And so, yeah, we may see some of our lowest numbers in a while as far as inpatients who are very, very sick patients. Remember, you have to be very sick to be admitted to the hospital. And so we may be seeing lower numbers there, but we are still seeing patients every day in our emergency rooms, in our walk-in clinics, in our clinics, physician clinics that are being tested because they have symptoms or we suspect that they have COVID too. So I would just say that yes, we do feel good about where we are today. We're down to the use of just one ICU for COVID patients, and we are feeling comfortable with what we have staffing wise and resource wise. We're well supplied with PPE, and so yes. But we have, as we meet Monday, Wednesday, and Friday with those that are presenting on this call, we have total faith and trust in their decision-making and using all the pieces of the puzzles and moving those around, as Penny said. And at a moment's notice, when we see data changing or we have concerns, they listen. And they've continued to listen. And so we feel very comfortable with where we are today and where we're headed.
Okay, so next question for Penny. I'm sorry, lost my string here. Yes, it is for Penny. Numerous readers, and this is from Emily again, numerous readers reached out this week to ask about how to set up appointments with OptumServe. While there is a delay in setting up the site, what can those people do to set up an appointment early? Do they need to be pre-screened for eligibility like the IU Health tests?
Good question, Emily. The testing site, you do have to register. So you have to have an appointment. You do that online. And it kind of walks you through it. And the requirements, the restrictions, or the criteria for testing is looser than it has been. And so there's not a lot of restrictions, to be honest. So it just kind of takes you through that. You have to register, and then it gives you the available appointment times, and you can schedule those. I just caution people about doing it too early because we've ran into these problems, and it's just unforeseen circumstances, and the new site needed to put some safety things in place and set up so that everybody being tested and the staff and everything would flow well. So we didn't anticipate that, and that's what caused the delay. But people can certainly call, or they can call, but they should go on the website to make an appointment. That's the best way to do it. If you absolutely can't do that, there's a phone number. I do not have that at my fingertips right now, but we will make sure that that's available to people as well when the time comes. Did that, hopefully that answered that question.
Okay, thank you, Penny. Again, for Brian from Emily, regarding IU Health tests, are your guidelines still the same? Patient showing symptoms around someone who has it, have IU Health Network physician, healthcare worker, or first responder? Oh, got to unmute.
thought I had clicked it. I must not have clicked it hard enough there. Sorry about that. Yes, so we have expanded our testing, and we did that a few weeks ago to any of those who call the hub. So they call a virtual hub, similar to what the State Department of Health is doing online. And you go through a screening process and they refer you to one of the testing sites. So you do not have to be an IU Health patient. You can be anyone who calls and we can refer you to a testing site in one of our areas. That's been expanded for the past few weeks, but now a few weeks ago, we actually are ordering it from all of our sites, any IU Health site. But no, if you go through the hub and you screen through those questions, you'll be referred to any of the sites across the state to get your test.
Okay, and we still have a few more questions. So as I'll invoke Ted Koppel for the second week in a row and tell our affiliates we're going to run a little bit long. This is from Ethan Burks from WFIU, WTIU. For anyone with phase 2 of the reopening process starting this weekend, what are the biggest challenges Monroe County faces in minimizing the spread of COVID? What's the plan if things get worse?
Ethan, I think, this is Penny, I think probably just compliance with all of the restrictions that are in place, whether it's part of the governor's order for reopening. Just because a business is able to reopen, there are 50% limits or other limits on things. They have to have the social distancing. It's going to be making sure that every business and every individual does their part. And that is why we really are stressing today more than ever. I think we have every time we've talked to you, the importance of that physical distancing, and why we're really saying and stressing the need for wearing a face covering when you're in public and you're around other people.
Can I just add, I would totally echo what Penny Cottle said, and just add, some of this can just happen almost randomly, where a particular site can have a surge and a hotspot develop despite the best efforts of folks. It can happen if an intense gathering happens where somebody may be quite infectious and they don't even know it. So there are things that can happen even when we try to do all the good things which Ms. Cottle indicated. And lastly, the question about what we'll do. We're really on a spectrum of controls. We've moved a little bit. If we need to move back, we would. If we need to hold where we are, we would. So it's really that spectrum of restrictions and controls that will be moving along in the coming months and hopefully moving forward. But if we have to move back or stay steady, we will, I'm sure.
Okay, another question from Ethan for Penny. The ISDH's dashboard that was updated today had conflicting numbers for Monroe County compared to yesterday. The number of deaths went from 10 down to 9 in the last 24 hours, and the number of people testing positive went from 146 to 144. Could you clarify what the latest numbers are?
Yes, I noticed that too. What happens, it does occur occasionally because people move from, they may be in a facility, a hospital or some other facility, but they're a resident of a different county. And so usually what happens is that they have been counted, for instance, as Monroe County resident when in fact they were not a Monroe County resident. And so that has been cleaned up. So the state caught it somehow. What can happen, the testing site or someone, they may put it in as the wrong county. If you can imagine some good examples, we have people in Monroe County with Gosport addresses. Some of them are in Monroe County and some of them are in Owen County. I think that happens around Brown County as well. So sometimes those things can get put into the system incorrectly, and then they're corrected, and that can play a part in that. So that's where those differences are. It's just sort of cleaning up actual residency of individuals.
Okay, this is one more from Ethan. Can the city or county make people wear masks as a legal requirement when entering a public place, or can businesses do that for themselves?
Businesses could certainly do that for themselves, and that's what in the governor's order, that's the recommendation. While in this pandemic, we might be able to order that. Enforcement of that becomes a very difficult issue. And as always, we would prefer to get voluntary compliance and get people committed to keeping everyone safe. Remember, for instance, the face coverings, I do that to protect you. And I hope that somebody else will wear theirs to protect me. So I see it as a caring thing, that if I wear my face covering when I need to, I'm protecting and telling other people that I care about them.
Okay.
I would just
Yeah,
add,
go ahead, John.
I'm sure Commissioner Thomas too could add that in the public buildings, of course, yes, we do set rules. We will have a mask requirement in City Hall when people enter, as they can in limited ways starting Tuesday the 26th. And in a public facility, we certainly can do that just like a private enterprise could. In the wider general public, that's a whole different health order that would be required.
Okay.
Right. I would just add that we are requiring our employees who are returning to work to wear face coverings. And once we do begin opening to the buildings to the public in a limited way, that there will be a requirement for the public, but we are going to be providing that capability for them. So if they don't have that, we will make sure that they do. Thanks.
From Emily Ernsberger from the Herald Times, this is for Penny. There have been some concerns about how certain foods are handled at the farmers market, namely why some food and beverage artisans are not able to sell some prepackaged or frozen foods. Why can they not be sold at the market when they can be sold at the grocery store?
Well, part of that comes through the governor's order in terms of seeing farmers markets as certified markets as essential food. And actually, the prepared food vendors don't necessarily fit into that definition. We are continuing to work with the markets, and we communicate with the state health department, with other county health departments, with our environmental health association and food protection committees on the best practices for that. And right now, that's kind of where that stands. As we move forward, I would assume that at some point will change, but right now, the prepared food vendors are not allowed.
Okay, and one other question that's come in through Facebook, a question about when and if youth sports can resume.
In the governor's order, I believe that is mid-June. The governor will also, stage 3, 4, and 5 of the state order is projected. So what people have seen for stage 3, 4, and 5 is only projected, and he will come out next week with those, with his new order and those specifics. We've also been told that he will clarify some things. As you can imagine, there's lots of questions. We have questions, we get questions, sometimes we can't answer them, or we think we can, but then we find out, well, maybe that wasn't the interpretation at the governor's office thought. And so we work through those with them. I'm sure there'll be more questions, but I know that some of the questions that have been raised are being addressed next week. And one thing I want to go back just to Emily a minute ago, because not all, there are some home-based vendors with essential products that are deemed essential, soaps, those kinds of things. So there are some home-based vendors that may have some products allowed, but if you're talking about cooking something that's potentially hazardous and freezing it and then bringing it to the market, those are the kinds of things that are not allowed.
I just was going to add from the City Parks Department, it is a big, complicated puzzle. We're working very intensively to look at whether it's youth sports or facilities like pools or adult leagues. All those things are affected by the state order, to be sure. But we're also trying to understand the local dynamics of that and different leagues and what kind of exposures there might be. Again, I would exhort, we're better safe than sorry. And just because you can do something doesn't mean you necessarily should do something. So the Parks Department will be making announcements in the days and weeks ahead on individual sports leagues and camps and all those kinds of things, which is a complicated process, as you might imagine.
Okay. All right. Well, thank you all for your time. Thank everybody for your questions. And that, of course, we still have many more questions that will need to be answered. And if you see, those of you watching on Zoom, there is a link to the pledge video that's up in the chat as well. So thank you again. We will return on Friday for another edition of this and answer more of your questions. Thanks, everybody.
Thank you. Take the pledge.
Take the pledge.
Take the pledge.
Take the pledge.